Hello, I'm Stephen Mcculley. I'm a consultant reconstructive and aesthetic surgeon, and I'd like to talk to you about brachioplasty, which is the posh medical term for upper arm lift tightening. Now, this is a procedure for women and men, but particularly women who have often lost quite a lot of weight or have always had problems with the excess skin, sometimes referred to as back rings, but I prefer the term brachioplasty. Now, the operation really to do this involves surgery, and that involves excising the skin, usually along the line of the upper arm, leaving a scar from the elbow hidden within the inner upper arm and down into the armpit area. Now, that operation takes between 1 and 2 hours, depending on how large an area needs to be removed. Occasionally you can do it just with a scar in the armpit area, but that's really only useful for patients with quite minimal excess skin. I sometimes use some liposuction at the same time to liposuck the area and the upper outer arm to try and improve the contour as much as possible. Now, this is all a very routine operation, and you can produce some really quite dramatic changes to the arm, but you can never completely tighten it because if you try and stitch up the skin too tight, you just end up with some wound healing problems. Now, that's uncommon, fortunately, but there are also other potential risks like bleeding, infection, altered sensation, and occasionally some swelling on the arm. Overall, as I say, this operation has a good outcome with some very good changes. You would want the equivalent of 10 to 14 days off work for this, but for the majority it's a quick recovery and you'll be up and about the same day, although you may actually stay in overnight. So, a good operation if you're looking for changes to the upper arm. Whether you're going to come to see myself or another reputable surgeon near you, I wish you the best of luck with your brachioplasty surgery.